Welcome to another episode of Living with FASD, Candid Conversations with Patti Kasper. This podcast is for those who are living with the effects of prenatal exposure to alcohol, their loved ones, and anyone else wanting to learn more about fetal alcohol spectrum disorders. Each week, you'll hear from someone whose expertise is either professional or living experience with FASD. I'm your host, Patti Kasper, bringing you both. Now let's get started with another candid conversation. And welcome back to another episode of Living with FASD. Today, I am so excited to introduce to you Dr. Elizabeth Cleveland from the Fusion Center. This is one of the episodes that is going to feature a program. And I'm really excited because this time the services are for adults. Yay! So without any further ado, Dr. Cleveland, Elizabeth, I'm so grateful that you could take the time out of your schedule. And so quickly, too, when we just came upon each other's radar like a week ago. Thank you for your time and welcome to Living with FASD.
Well, thank you. Thank you for having me. I'm excited to be here and to share about our clinic.
Yeah. So physically, where is your clinic located?
We are actually a virtual clinic. So Fusion Center Network is a multi-state virtual diagnostic clinic.
Okay.
We've realized that a lot of people, and especially adults, often have difficulty with transportation, and we didn't want to limit who we could access because of that. And so we are virtual. We have figured out I think everybody has figured out how to be a little more hybrid in what we're doing thanks to the pandemic. But we've kind of mastered that aspect of it. And so we can provide, ours is a HIPAA compliant Zoom system that we use for our diagnostics.
Okay.
Yeah.
And I love that. I mean, being that everything I do is virtual as well, my coaching business, my professional development training business, it's all virtual. So I'm totally on board with that, totally excited, but I'm also totally curious because how does the multi-state aspect work when, do you guys bill insurance? Because that tends to have state boundary limitations, yada, yada, yada. What does that look like for the Fusion Center?
You're absolutely right. Insurance companies are complicated, and we are private pay with a sliding scale. But the regulations that we adhere to for each state have to do with licensing and things like compliance as far as privacy and patient privacy and business and that sort of thing. But we don't communicate with insurance companies because it is so complicated. And because FASD is not often recognized with insurance companies, as you well know. So, yeah.
So let me ask you, Elizabeth, about your background. What brought you into the FASD space? I'm always so curious about that. I've shared my story with the viewers many times, but it's a question that I typically ask my guests, why are you here?
Yeah, it's a great question too. And I think I love that every person has their own avenue for getting into the field. And for me, that avenue was through my PhD program. My background is in speech language pathology, but I knew I wanted to get a PhD to work at the university level. And when I did, with my first semester, I was introduced to FASD. And like many people who are introduced to FASD, a light bulb kind of came on, and I realized that I've got a living experience with a family member, which then lit the motivation for me. And from then on, my research was devoted to not only FASD, but how that applies to people's lives, including diagnostics. It's a big part of my research, but then things like working memory, executive function, that sort of thing.
I often tell people that once you learn about FASD, you are forever changed.
It's true. I agree
forever
with you.
changed.
Yeah.
Yeah, there's no unringing the bell.
There's no, that's a great way to say it. There's no unringing the bell. That's
Yeah.
true.
And when the prevalence rate conservatively is 1 in 20, everybody knows a whole bunch of people who are impacted by prenatal alcohol exposure with or without a diagnosis.
That's exactly right. And it's so prevalent in other populations too, like the autism population, like the ADHD population. It's just that right now society doesn't know to consistently look for that prenatal exposure aspect. And
Right.
so there's no telling what the weighted estimate is.
Yeah. And there's so I have there we go, knocking my microphone around. This is such a passionate topic in the moment, right? Because we've got Bobby Kennedy Jr. saying, "Oh, autism," and I celebrate that anyone is wanting to get to the root of the problem. It's naive to think there's just one. There's going to be many. I think the alcohol could be part of a cause, but there's also all that overlapping symptoms. Those of us who are in the FASD space have been anticipating this spike in symptoms among kids for years now. When the shutdowns boosted alcohol sales by 40%, we all knew this was coming.
Yeah.
I'm so disappointed that it's all attributed to autism. And some of it very well may be, but I think a huge portion of it is actually FASD.
I agree completely. And what we've seen in the clinic speaks to that as well. I mean, a lot of the patients who come to our clinic suspect autism and their parents suspect autism. And sometimes there is autism spectrum disorder
Without a doubt.
and prenatal alcohol exposure. So which came first, the chicken or the egg? And as a diagnostician, you have to be able to kind of parse those details out. But you're exactly right. It can be very harmful to suggest that there is one reason that a spectrum is present, and we know that is not
Naive.
all.
It's
There's
naive and it's wishful thinking, and it's not going to help things truly.
Yeah,
Um,
absolutely.
you know,
And insulting for a lot of families to have talked to
totally,
a lot of
totally.
families who feel feel scared right now that there's going to be even more stigma associated.
Yeah, I know so many people who were told that either they or their child should by doctors, should run with the autism diagnosis because there's better accessibility to services.
Yes, I hear that on a regular basis.
And that too, I think, is naive because the go-to treatment, the best practice, right, is ABA therapy, which is a behavioral model which
Mhm.
uses motivational strategies. You cannot use motivational strategies to address neurological deficits and
Absolutely.
expect long-term success.
And there's just not evidence that ABA is a treatment that works for FASD. And you're right that so there's harmful both personally and emotionally, but also can be harmful in other ways too,
It
and
is
can
harmful.
really make
It,
symptoms more significant too.
yeah, yeah. I don't know how many parents have come to me and, before I was in this space totally, when I was still working in foster care, saying therapy made my kids worse. Why are you guys making me send them? And I'm so
Um,
sorry that the therapist doesn't know what FASD is or
it's
how to work with it.
the medical field is so siloed. Mental health is its own silo. behavioral health has its own silo, developmental disability related interventions has its own silo, and there's not good communication between any of them. And until that happens, and until the silos are broken down and we can look across fields and know this symptom looks like one thing but could be because of another thing, then we're not going to make progress, and we're going to see frustration from families, and education is thrown in there too.
Right. And meanwhile, the parents are being blamed for undermining the therapeutic process.
Yeah.
I've worked with many parents who were labeled as having fictitious disorder, which used to be called Munchausen's, right? And even 20 years later, their kids are still being denied services because that label was unethically put upon a parent
Yeah.
years ago.
You know, we are taught, medical providers are taught on a medical model. We are taught, and this is speaking as a speech language pathologist who taught and actively teaches related communication, development disorders, taught what can you as the professional do to fix your patient. And that's just not an approach that works for human beings. And until society, and I think that there has been a big shift in what medical providers realize about their patients and about the care that they're providing. But until we move to that social model of disability, which says the reason a person cannot access their environment has nothing to do with the person's skill level, it has to do with how accessible the environment is. Then again, progress is not going to be made.
Yeah. Part of it is you can't diagnose what you don't understand. You can't, none of us knew what we didn't know until we finally learned it. And, all the professors at all these universities, they can't teach what they've not learned.
Right.
And, there's an old adage, if you hear hoofbeats, then look for the horse. Right? Well, FASD is the frickin' zebra in the room. It sounds just like a horse. It sounds like autism or ADHD or conduct disorder or yada, 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 yada. But it's the zebra. And not only is it a zebra, it's the zebra the size of an elephant.
Who is trying to act like a horse because they think that's what society expects them to act like.
Yes. Yeah.
Exactly right.
Yeah. So tell me about the diagnostic process at the Fusion Center. What makes you guys different?
We
Other than being virtual.
Well, that's a great point. The virtual thing has made it, we've gotten a lot of great feedback about having that virtual component to it. But we use an approach to the diagnosis that instead of ruling a set of symptoms into a diagnosis, we are ruling everything else out, or as much as we possibly can. And there are areas that we're not going to be able to address. We can't do genetic testing, that sort of thing. And so we do make referrals if that's, relevant and appropriate. But otherwise, we're looking at all of the neurodevelopmental disorders under the umbrella, and we use the DSM-5 as a guide for our diagnostics, and going through what are the symptoms, how are they put together in this puzzle, and what is the best diagnosis that can fit all of the symptoms, not just the ADHD symptoms, or not just the learning disorder symptoms.
Yeah. Yeah.
So we use that kind of complex condition approach.
Yeah, that's wonderful. And what can someone that reaches out to the Fusion Center expect in terms of wait list, in terms of the process, like how many sessions, how many hours, what all would that look like?
Yeah, great question. So we are very easy to get into. Referral process is not hard. People can just go to our website, www.fusioncenternetwork.com, and go to the tab for requesting an appointment. And then from there, they select, there's like a caregiver tab, and then we have a contract with Arkansas DCFS, the DCF, our Department of Children and Family Services, to provide diagnostics for that population too. So it depends on who the person is. If it's a parent, if it's a provider, if it's somebody who we've got a contract with, they'll just click on that link and then fill out the very short form. And then our team will reach back out to them via email, and we'll give them step-by-step instructions on what to do next. And that consists of filling out a pretty long questionnaire before they come to us. A lot of evaluators, a lot of diagnosticians use direct testing approaches to see certain skills. And what we realize is that a lot of times that direct testing doesn't tell us exactly what's going on. So many people who have an FASD do poorly in a group setting or in a classroom or that sort of thing, but do really well one-on-one when it's quiet and low executive function demands, that sort of thing. So the questionnaire that families and caregivers will fill out has a lot of the functional aspects of skill level for their loved ones. Adults will fill it out for themselves. And then once that is completed, then we'll send a link to our appointment calendar. And our wait list is not long. We pride ourselves on.
What does that mean?
Well, I mean, within the next month.
Woohoo!
Yeah.
You hear that, everybody? There's your call to action. If you suspect, go. Go now.
Yes, absolutely, we can help. And if it's not FASD, we will know that. And if you don't have confirmation of prenatal alcohol exposure, don't let that stop you from reaching out to us, because that is not a game changer for getting a diagnosis of a neurodevelopmental disorder. And we can mentor the families through that process as well. So
you guys also diagnose other neurodevelopmental conditions, not just FASD.
That's right.
Okay. Yeah, I saw that on your website, and I'm so glad you brought that out, because I wanted to highlight that. You know, we've talked about siloing, right, in our conversation, but it's really not a competition, you know, between which diagnosis do you have? Right. That's not it at all. It's about getting the right fit, the right combination, you know, and in the case of FASD, it is important to have that accurate diagnosis, because thanks to the lay of the land survey that the ALC did a few years ago, we know that there are 428 physical conditions that those of us with FASD have a predilection for developing.
Yes.
That's a valuable part of medical history that physicians can use for any number of physical concerns to rule in and rule out as they're making their apparently unrelated diagnosis.
Right.
When it really is related.
That's exactly right. And that's some of the guidance that we give to adults who come through and parents who come through, to say, tell your physician to be looking out for these. And we put a long report together after the appointment itself. It's about a 2-hour appointment for the main evaluation. And then the report is sent to the family or the person who has come through the clinic. And then we have a follow-up session to make sure that they know what the report says. Yeah. Too often we get these reports from medical providers and we're like, here's a bunch of numbers and I don't know what any of these numbers mean. And a lot of text, and I've got a reading impairment and can't, or I'm not a medical provider and I don't know what any of these words mean. And then I'm having to go and look it up. So we make sure that our families know what everything means, know what the next steps are, know that what we're recommending, and go from there.
Yeah, that's awesome.
Yeah.
So what about how long is the process from beginning to end? Like once you guys contact them and get them scheduled, what are we looking like in terms of people finding out, is this something I'm dealing with or not?
So unless there is some reason, maybe there's not enough information at the time of the appointment, maybe you're waiting on confirmation of prenatal alcohol exposure, but you don't have it yet. Unless there's those circumstances, and a diagnosis can be verbally given during the appointment, and then the report will come within a 2-week period after that, and then it's kind of up to the patient and the patient's families for how quickly that next session comes.
Okay.
Because once the report is sent, we send another link to an appointment calendar for a follow-up session.
Okay. That's an amazing turnaround. That really is best practice. A lot of facilities need to be shooting for, you know.
It's hard too and we, it wouldn't happen if we didn't have the great team that we have, for sure.
Truth.
But families are in crisis.
Yeah.
And they want answers, and they want them today and want them now. And I understand that. We understand that. The other two team members, Emily Rusnak and Angel Gramillion, are both parents of adults with FASD. And know how important it is. And then my family member went through years and years of testing, never to get an appropriate diagnosis, went through all of the medication issues that people with FASD often go through. And
it didn't work because the diagnosis was incorrect.
Well, exactly.
Yeah. And then you got all the side effects and feeling horrible.
Right. And then dysregulation symptoms get worse, and anxiety symptoms get worse, because of not being able to access their world. So we try to make it as easy as possible for everyone who comes through.
Yeah. So in our conversation shortly before we started recording, you kind of teased a little bit that you guys offer services for adults. Tell me what that looks like.
Yeah, so we definitely do diagnostics for adults. It doesn't matter how old you are or what your background is, as long as you've got the information that we need, then we can help you with that. And even if not, even if you're missing pieces of information, we can still help you. But we also provide training, we provide what's called technical assistance. So if an adult, for example, is having trouble with employment opportunities or those sorts of things, we can provide services to help that adult. And then we have consultation hours too. And this is important not just for adults, but for families as well. A lot of us have questions because we don't know what to do. Yes, you've given me the diagnosis. Yay. Now what?
Yeah.
And so we can answer those questions based on the evidence, based on what we've seen in our clinic, based on lived experience, and the combination, and help people thrive.
Yeah. And I think that's part of, because I've been communicating with your one partner, Angel, about submitting a video, because you guys have a large video library that's available to professionals, also family members, diagnosed adults.
Yeah, so that's through FASD Collaborative, which is a separate company, but very much interrelated because the staff are the same. But yes, that webinar library, we refer to it a lot because it has such great information from experts all over the country and even internationally as well. And those are free on FASD Collaborative too. Okay.
Yeah, I know I sent her a fairly brief video, like 15 minutes, for adults who are diagnosed. And because in fact it's called Now What?
Yeah.
So, now what? What do we do now? And I remember when I received confirmation, I already knew, right? Because I've been working in this, I've been immersed in this space for years now, but it was validating to get that confirmation, NDPAE, boom, there it is.
Mhm.
And it was kind of funny too, because the SLP whom I had worked with said, yeah, you're really high on that ADHD scale too, but that's not in my sphere of, my little wheel. I can't officially diagnose that. I mentioned that to a friend. She goes, girl, I've known you had ADHD since the minute I met you 7 years ago.
That's too
Really,
funny.
I just started thinking about it.
Yeah, it's amazing what the people around us know about us.
Okay. So that's just, I'm so excited, and I hope to have you guys flooded with referrals.
Well, thank you. We're excited too. There's a lot of people who are doing great work, but there's not enough of us. And
Yeah.
there's not enough, especially with the high prevalence rate, and especially as it overlaps with other neurodevelopmental disorders. There's just not enough of people who are working in the field. And so that's one of the reasons that we decided to become a multi-state clinic, because we realize we can make more of an impact with broader population, a broader patient basis.
Yeah.
And it's been really rewarding and fulfilling.
Yeah. And with that exhaustion from being so dedicated comes that intrinsic reward too.
Right. You're exactly
Because it really is a changed life. It changes nothing and everything at the same time. It doesn't change the history, it doesn't change the past, it doesn't change any of the ACEs that we've gone through because we weren't understood.
right.
But it provides that validation, and with that comes self-acceptance and grace.
Absolutely.
And that is life-changing.
There's nothing more exciting to a diagnostician than watching someone who has come through their clinic in crisis or in confusion grow into an identity and become an amazing self-advocate, an amazing leader in their own lives, when a lot of people haven't ever been given that opportunity to be the expert in their own life.
Yeah. Well, I am definitely, the next time I revise this, I will be putting Fusion Center front and center in the resource list in the back.
Well, thank you. We love that.
Yeah. And on my website too, I have a recommended reading list and, resources tab, and I'll definitely put you guys in there. So,
Perfect. That's fantastic.
yeah.
Always coming up with new ideas too. So we'll make sure to keep you aware of the things that are happening in the clinic and the resources that we're building, so that you can share that with your individuals who have FASD and their families too.
Yeah. So tell me how do you guys work around the lack of confirmation of alcohol exposure because the prevalence rate overall is 5%, or at least pre-COVID was 5%. Like back in 2018, it was 5% and 44% autism. One in 44 rather, not 44%. 1 in 44 for autism, 1 in 20 for FASD. But where was I going with that?
How do we work around not having
Yes,
that?
within foster care and adoption population,
Yeah.
a conservative estimate is 70%. Hello.
Yes.
That's conservative.
Yep, that's exactly right. And with the adult population too, a lot of people don't have access to that information or can't get that information for whatever reason. So the diagnostic process that we use is that rule out process. So we're making sure, even without confirmation, that there's not something that would better explain the symptoms.
Okay.
And if the only difference between an FASD diagnosis and an unspecified neurodevelopmental diagnosis is a lack of confirmation, then we can't give an FASD diagnosis without confirmation, but we can give resources, and the unspecified neurodevelopmental diagnosis is what we give. And then we mentor as if the person did have confirmation, because best practices for FASD work for everybody.
Yes, they do. They
The
do.
neurobehavioral approach works for everybody.
Yeah, I've got one colleague who's I've had guesting on the show many times, Deb Evenson. She was, from back in the FASD pioneer days up in Alaska. She would always talk with educators about, if you invest the time for your 1 or 2 students, you will find that all of your students benefit.
Yes.
And that's true for, whether it's the classroom or whether it's a clinician with a caseload. By learning how to work with the neurodiverse clients on your caseload, all of your clients will benefit
Absolutely.
from that approach.
That's so true. And many people think that but when they first learn about neurobehavioral approach and first learn about accommodations and things like that, many people think that people with FASD don't skill build. We just kind of accommodate, and that's not the truth at all. It's the combination of the two that is so necessary.
Yeah.
And it's not one or the other. And skill building does not mean discipline, and does not mean
Thank you. You can't discipline away brain cells that aren't there.
Right.
And you can't motivate brain cells that aren't there anymore.
Yes, right.
Right? When you have reflexes, survival reflexes getting triggered, from people who have been blamed, shamed, punished lifelong, you're not going to be able to, there's no slowing down a reflex.
That's exactly.
It's instantaneous because your survival depends on it.
That is exactly right. Exactly.
And I've had this thought coming through my mind so many times, and again, it has flitted away. I hope I remember it before we end the conversation.
Just interrupt.
That's really good.
Interrupt me the next time you think of it, okay, Patti?
Really good. Darn it.
That's like me too. That's so frustrating.
I'm working hard on not interrupting people because I'm so excited about a thought that came through my head, right? Folks, does that sound familiar? I do it too.
Well, Patti, you have my permission to interrupt me if you think of that thought. So just know that I can't wait to hear your thought.
And it has something to do with how we launched into our conversation at the beginning about all this emphasis on ASD.
And that behavioralist approach.
When it's probably FASD. Just people think of the horses instead of the zebras.
That's right.
And that's still not triggering it. It'll come back.
Well, to your point though, even anybody who is even the smallest bit neurodivergent, or even just a little bit different from the norm, has a difficult time when expectations are so cookie cutter that they're only applicable to one type of person. And unfortunately, our education systems, many of our clinical systems are restricted because they're having to adhere to those cookie cutter standards.
Yeah. And insurance plays into that. So
Yeah.
I'm really glad that you guys don't even bother with that. You said a minute ago, evidence-based, right? Mm-hmm. That the emphasis on that is all insurance driven.
Yes.
But that denies the reality that FASD is multidimensional, multifaceted, because the hit that we experience, not only to brain, but also to body, to the totality of our being, depends on so many factors, right? The gestational age at time of exposure / exposures frequency, intensity, what was developing at the time, what function was being programmed at the time, other substances being used, maternal stress, genetics, was dad drinking 3 months before pregnancy? I mean, it just goes on and on and on. So there can be no firm and fast, predictable FASD pattern in psych testing, because that's why there's always scattered findings.
Right. That's exactly right.
There can be no clear and concise pattern because there are so many flipping variables.
That's exactly right. And that's why it's important to look at the various skill areas, because you're right. There's a reason that it's called a spectrum because everybody is different on that spectrum and everybody reacts different. And if you've got a supportive environment, you still have FASD. You just may not be showing those disabling symptoms because the environment is not disabling.
Right.
And so it's going to look different depending on just like you're saying, every aspect of a person's life.
Yeah. Yeah. And I've had a couple thoughts come and go with that. Doggone it. Candid conversations.
I know,
My FASD is showing it.
It's such a real life thing though. And
it really is.
Gosh, what if every person that we talked to was like, it's okay. We'll help you get to those thoughts.
I mean, it's like a butterfly. It just, comes and flits right off again. Or a hummingbird, even faster than a butterfly.
That's a good analogy. Yeah. And hummingbirds go backwards too. So
there we go.
That's too
momentary flashes of brilliance. It has been delightful to have you on air with me today. I hope you'll come back again for another episode.
I would love to, Patti. This has been a great conversation. Thank you so much for having me.
I just am absolutely thrilled to get this out there. Yeah, everybody, please send me your questions for Dr. Cleveland, and I will ask them when she comes back. So, yeah, we'll leave it like that. You know what? Let me ask you one more thing. What, in light of the current focus on ASD that everyone hears about, I mean, you can't turn on the news without having, hearing and watching another conversation about this. What is one thing that you want people to know?
What a great question.
I have those occasionally.
You've had them the whole time. So if this is an occasional thing, I feel very lucky. What is one thing that I would tell people? I think that when the highlight is taking I should say when the media is taking the limelight away from the progress that has been made into the FASD world, it's taken that away. And not that autism shouldn't have its own limelight, because absolutely neurodivergence is neurodivergence, and it is people who are neurodivergent are not accepted at this point in time in the greater society, and we have work to do as allies and as advocates and as self-advocates. But to answer your question, I think it's important for people with FASD and family members to know that even though that limelight is in the media getting pulled away, people who have been pioneering in the field are not going anywhere. And the effort is still moving forward, and there's still progress that's being made.
We are a stubborn bunch, aren't we?
That's one of the best things about us, isn't it?
I think it's called perseveration.
Yeah, call it what you want. It is why things
not always a bad thing.
It's not. And that's acceptance. That's inclusion. Take what we have been told is a bad thing and turn it into a strength, because that's exactly what it is.
Yeah. What a delightful conversation. I'm so glad to have spent this time with you today. I can't wait for you to come back again.
Thanks, Patty. Me too.
All right, take good care. Thank you for joining me for this episode of Living with FASD Candid Conversations with Patti Kasper. Feel free to send comments, questions, and topics you'd like to learn more about, hear more about, to me at livingwithfasdpodcast@gmail.com. Please remember to like, follow, and share this podcast on whatever platform you use so that more people can find the podcast. Have a blessed week, everyone, and tune in next Monday for another candid conversation on Living with FASD.